everybody. I am here with Dr. Jones, DC, at Colorado Medical Solutions. You can find them at coloradomedicalsolutions.com. So we're here to talk about their treatments for ED and the success they've been having with that, as well as some of the common misconceptions with treating ED. So Dr. Jones, thanks so much for joining us today. I really appreciate it.
Yeah, thanks for having me.
Yeah, absolutely. And I wanted to start off just by asking how long you had been working in the men's health industry and specifically with ED.
Yes, for the past 8 years now, we've been treating men and women both for HRT as well as sexual wellness needs.
Awesome. It's good to hear. And was there anything in particular that really, drew you towards that, or was it just seeing how much of a need there was for it?
Yeah, so it started with the HRT, and it really started with myself. I was dealing with a lot of brain fog and a functional background myself, and doing everything that I can naturally just didn't really handle my brain fog, and just I knew something was off, and HRT was just a game changer for me. I never struggled with ED myself, but when you get into the HRT space, you realize half of the men as well also suffer with erectile dysfunction, probably more than half. And then my mother, she was going through menopausal symptoms, and again, I tried to treat her with the functional medicine, and we definitely helped more with her symptoms than we did with my brain fog, but still a big piece was missing. And so we got her on BHRT for women's health, and it was a game changer for her. And really, that whole experience has really caused me and my clinics here. I have one in Denver and Colorado Springs to really move out of functional medicine. I refer out now for functional med. I refer out for patients that need primary care. And I really like to think of what our clinics do now is more into the optimization of both pain management and anti-aging. And we utilize, these cutting edge health services such as, for men and erectile dysfunction, specifically shockwave and P-shots.
Yeah, that's really good to hear. And what do you feel like it is that, most men aren't, willing to talk about, their ED or try to get help with it? It's one of those things that they seem to just, kind of mention as a last thing on the way out the door with their primary care.
Yeah. So I think that has a lot to do with just the stigma of erectile dysfunction. I think that it is a very personal, touchy, emotional topic, and so it's difficult enough to talk about it. Is my partner supportive? Are they not supportive? Do they tell me they don't care but I care? Do I care that they don't care? I mean, there's just so much with it that it's difficult. And then I think most men know that really the only option is medications. And there is also a penile pump implant too that is standard medical options, and that thing is horrific and barbaric, and I still see men that come in sometimes, post having done that, and I've never heard anybody happy with having gotten that option. So there's really not a lot of options either. The standard medical path, and so I think it's a little bit of that, like we talked about, difficult to talk about it in general, but then when there's not a lot of options in front of you, why even bother talking about it?
Sure.
I think there's a lot of that going on too.
Yeah, definitely. I think that's a great point. I think definitely getting some of that education out there can really help that. And I think, us as guys, so much of our ego is tied to that. And so it, can be really difficult and feel like there's something wrong with us. And I think it definitely helps knowing, how many men actually do suffer with that.
Yeah.
Yeah, definitely.
Absolutely. Yeah, that makes sense.
And what are some of the most common, causes of ED that you see there at your practice?
Yeah. So, I think ED is one of those symptoms of poor health overall. When we look at ED as a whole, we're talking about a blood flow issue. Well, where does the blood flow issue come from? And then that can be broken down into a combination of just the blood vessel supply itself, the integrity starting to decrease, blood vessel die off, blood vessel integrity decreasing, and then we have plaque buildup, right? So those are the two causes of blood flow issues. But then what causes those to happen, right? And it's not just an aging thing, it's an inflammatory response. Well, what causes the inflammatory response? And so we really got to look at the big picture. And I think what separates our clinic from many other clinics is my functional background. So we do have these amazing therapies to tackle the blood flow and the plaque, but we also take an integrated approach as well because you can do all the shockwave and P-shot therapies and get people fixed up, but are you addressing the underlying issues behind the plaque buildup and the blood vessel supply? And I find that the number one cause is diabetes. And I think that blood sugar is a huge contributor to ED. It's also a huge contributor to pain as well, because the body's inability to heal. And so we really like to target that in combination with our therapies to get the best possible outcome and also make the results a lot longer lasting.
Yeah, definitely makes sense. And so when a patient comes in, do you like to do, kind of just a thorough, examination, find out what their background is and figure out, obviously, can we help them with the shockwave and the P-shot, but what else do we need to do to really get them the best results?
Yeah. So we do like to make sure, are we dealing with a diabetic or not? Are there any comorbidities? Are there any particular inflammatory causing conditions? The treatment protocol is always going to be shockwave and P-shots, the combination of both. And I can get into the protocol specifically because there's a penis pump involved as well. But then we also like to take a dive into, okay, here's the direct head-on approach that's going to fix you. And we don't have to do anything else, but we strongly recommend we also co-look at the diabetes. Like diabetes is going to be the most common thing that we're going to co-treat at the same time. Because I tell the guy, look, do you want to spend this many thousands of dollars and get this much results? Or would you like to spend the same amount of money and get potentially 50% or even double the results and have it last a lot longer? Balls in your court. And well, how can I do that? Let's co-treat your diabetes at the same time. Right. So we kind of make it an option because, for some men it's overwhelming. Just treat my ED and that's it. I'll worry about that later. I don't care that it's going to cost me more in the long run. Fine. Other people had no idea. Most people had no idea. Sure, I'd love to do both. Why wouldn't I do both? It's very logical. And so we like to do that thorough examination and present kind of both paths and let them decide.
Yeah, it definitely makes sense. And so, can you explain more about the full protocol and exactly how, shockwave therapy works and what it can do?
Yeah, so shockwave therapy was really, I think, gained a lot of traction through Gainswave. Gainswave was like the first big brand that came around. And then now there's a ton of clinics that do it with the name, without the name. It's the same machine. It's extracorporeal shockwave therapy. Is the medical term. Essentially what it is, or acoustic wave therapy is kind of another name. But basically it's modified sound waves that are delivered from a machine that then transfers to a handle. So you have an operator, you have a patient kind of laying back. Usually you numb the penis and the shock waves are administered through this handle, basically all around the penis, all around all the vasculature that you can imagine that supplies blood flow to the penis. Sessions are about 15-20 minutes, and best results with shockwave are done twice a week. So and the shockwave, while on its own research shows it promotes blood vessel growth, as well, I really like it for its ability to break up plaque. I would say that is the primary reason why I incorporate that in my program. But then I also do the P-shots, and I think there's a lot less clinics that offer the P-shots. They're harder to do. It's a procedure now. It's a medical procedure. You got to have a medical provider do the P-shots. Unlike shockwave, can be administered by anybody, a medical assistant, for example. So a P-shot is an amazing procedure that is actually developed by Dr. Charles Runnels, the same guy that produced the O-shot, which is the female equivalent procedure. And this is where we utilize the patient's own platelets. So we draw their blood, spin it out, pull out the growth factors, isolate all that healing, and then we eject it up and down the penis. And it's not a painful procedure. I've had it done myself just to talk to patients about it. They numb it really well. That I feel like the P-shot is better for the blood vessel growth. So that's why I use them in combination. My kind of go-to package is 2 P-shots, 12 wave sessions, and a penis pump. So you get the P-shot from day one. We actually do a shock wave on day one before the P-shot. That kind of promotes a little bit of an inflammatory reaction on the penis right there. And then we follow up with the P-shot right after. So we already got that inflammatory response so that the platelets kind of have a bit of a drawing to it. And then they continue on with shockwave twice a week. They go home with the pump. Their homework is to pump every day for about 20 minutes. the pump, that's a really, really important part too. Because the pump is promoting blood vessel growth on its own, but it's also spreading those platelets throughout all the cavernous portion of the penis, which is very, very important through this healing response. And then we follow up with a second P shot 6 weeks later. By that point, they're done with their 12th wave sessions. We do another P shot, and then we usually follow up with them 6 weeks after that. So it's about a 3-month program for us to really see, how much result they're going to get from this program. And that's going to be our direct head-on treatment for erectile dysfunction. And then if we're doing a diabetes program, we have this whole other thing that I'm not going to get too much into that unless you want me to, but that's a pretty cool diabetes program that we have as well that I'd like to do at the same time. So
yeah, definitely. That's really great to hear. And so the shockwave therapy, just lets the body know, hey, we need to, start promoting more blood flow here. We need to break up this plaque and everything. And then the P shot actually gives it, what it needs to be able to do that.
Yeah, well, yeah, the P shot on its own is going to promote blood vessel growth, but I think they just work in their own kind of pathways, and so I just found such amazing. The P shot on its own results were good. Shockwave on its own results are good. Together with the pump, results are great. And so I won't let a guy do a P shot on his own. I'll let guys do shockwave when they get to the maintenance on their own. But if somebody comes in with any amount of erectile dysfunction, they got to do at least 1 P shot and 6 wave sessions.
Okay, yeah, that makes sense. And what kind of results have you been seeing with that program?
Oh, great. I mean, I would say probably 85-90% of our patients are getting better. It's not 100%. It's we do our best after the examination to kind of let the patient know what our prognosis is. I mean, it ultimately comes down to how severe the ED is when they come in, and also how much inflammation is going on as well, the comorbidities, how diabetic are they, so that we can kind of give a realistic outcome.
Yeah, definitely. And I mean, comparing that to, like we were talking about the more traditional routes of, treating ED, especially with the PD-5 inhibitors, even sometimes with those working, there's typically a lot of side effects with those too, right?
Oh my gosh, yeah. I mean, one of the scariest side effects of Viagra is intracranial pressure and blindness. I mean, we're talking about medications here that are just systemically vasodilating the heck out of your blood vessels. I mean, a small amount of that is great. There's actually this whole thing called low dose Cialis, which is phenomenal for health, but it's called low dose for a reason, because those types of medications, they're very harsh on the body. And, like anything, the whole idea of taking a pill to treat your symptom is it's just not the right way to look at health. And, as a doctor of chiropractic, that's always been my philosophy, but I got into the medical space early in my career, and, I haven't looked back, because I think there's such a need for there's a lot more technology out there than we realize, that's growing at a fast rate. And unfortunately, most of it's not covered by insurance. And so, it does take some successful business strategies to implement these clinics that can actually effectively communicate to people, hey, these are your options. Unfortunately, they do cost cash, but here they are, and you deserve to know that it's here and take advantage of them if and when you're ready.
Yeah, absolutely. And what are is there any, side effects or any reasons somebody specifically wouldn't be a good fit for the shockwave therapy and the P shot?
Yeah, no, not really. I would say overall, with the P shot, it's if we draw their blood and it looks pretty like if their lipid panel, if the cholesterol is extremely bad, and sometimes we just can't get platelets out of it, that's pretty rare. As far as the shockwave, pacemakers, any type of electrical device in the patient's body would be a contraindication, but that's it. So very, very few things would prohibit somebody from moving forward with these therapies.
Yeah, that's really not bad. And yeah, if you wanted to share some of what the protocol is for those patients with diabetes, that would definitely be great for them.
No, I'm really happy that you asked me about that, because it's such intertwined with it's so intertwined with ED. I would say probably 50 to 75% of our ED patients come in with diabetes. I mean, that's what I'm seeing. And now, and then when I have diabetics come in, because now we're marketing for diabetes only, about half of the men to 75% of those men come in with ED. So it's just a confirmatory observation once I started marketing for diabetes specifically. So we actually do something that is super cool. we're the second group in Colorado to be offering physiological insulin resensitization therapy. Before, the only way to really treat diabetes, because diabetes in a nutshell is insulin resistance, the body's making insulin, it's not responding to it anymore. And so as a side effect, the blood sugar rises. Well, we know blood sugar being high can kill you. So standard medical treatment is a bunch of drugs. And meanwhile, the patient's insulin resistance doesn't get better; it gets worse. Their blood sugar is great, so they're tricked into thinking that, well, my blood sugar is fine.
Right.
Meanwhile, they're not really thinking of the underlying problem. Insulin resistance is getting worse. So the doctors are giving you stronger medications, and then eventually, what ends up happening, unless they make lifestyle interventions, patients end up becoming an insulin-dependent type 2 diabetic, and it just and that injection of insulin in that fashion desensitizes the cells even more, and it's a horrible hole that just gets deeper and deeper and deeper. So prior to this therapy, the physiological insulin resensitization, or PIR, the only way to get out of that hole was lifestyle. And lifestyle is still great, but now we got PIR therapy, which is very cutting edge. It's actually covered by insurance, which blew my mind, even including Medicaid, by the way. Awesome. And what it is we're essentially utilizing insulin as a hormone instead of a drug. So patients come in, they get hooked up to an IV. There's this mechanical pump that was built to actually function like a human pancreas, and it pumps insulin into the patient's body over a 3-hour period to mimic human physiology. We're microdosing insulin into the bloodstream, which is exactly what our body actually does. It doesn't wait till your blood sugar to get super high and then jolt out and release a bunch of insulin. That doesn't mimic human physiology. So when you look at the literature, they actually call that usage of insulin drug usage of insulin. But then there's hormonal usage of insulin, which is in this fashion. And that's what PIR therapy is. And when you do those infusion sessions over a period of time, we're literally reversing diabetes. And when you reverse diabetes or move it in the right direction, the ED on its own, even without treatment, will slowly get better. But when you use that in combination with our treatments, holy crap. So the diabetes treatment has on its own is amazing for my diabetics, but it really has just increased and enhanced what we can do with these men. So they come in, and usually what I'm trying to do, as soon as I see diabetes, we try to co-treat them with that. That's covered by insurance, so they're not paying anything more. And now we're handling the source of their ED and the side effect of the diabetes, which is the ED. So the results have just been really awesome. And then of course, if they need HRT, we put them on HRT too as well.
Yeah, that's awesome. That's really cool to hear. Yeah, I had no idea there was even, a treatment like that out there.
Yeah.
That's awesome to hear. And so, obviously it can be kind of difficult for, getting men into, the practice, even for, ED specifically, but obviously that's really good to hear, if they have ED that, it's worth taking a look at what the underlying cause might be with that. When do you feel like they should, seek professional help? Is it just when they see any decline in function with that?
Yeah, I think what I know is the sooner that you treat ED, the better. So when you start having decreased performance, when you start having sessions where you're not lasting as long, you're not getting as hard, catching it sooner is always easier. When I have men that come in those kind of situations, where it's I basically call it partial ED. So usually 1P shot, 6 waves is all they need. And once we start getting into the more progressive is when we start needing 2P shots, 12 waves, sometimes severe ED, 3P shots and 18 wave sessions. Yeah. It just depends on the severity. So it's always going to be better to catch it sooner than later.
Yeah, absolutely. That makes a lot of sense. And what would be the best way for patients to get in contact with you there if they're, local to the practices?
Yeah. So we have a direct number that goes to our call center. 720-465-1200. Also on our website too, if you're not ready to talk to somebody, you could fill out a form and then that triggers some of our information to be sent to you. And we can either call you or text you. You have an opportunity to kind of tell us how you want to communicate. So there's definitely, everything from calling us directly because you're just ready to get in, or if you want something a little bit slower, you can fill out the form and let us reach out to you, and you can, respond when you're ready. Definitely different levels. There's a ton of educational content because it's just so important for patients to understand that. So, even if you're not ready to come in, by filling out the form on our website, triggers a bunch of our videos and informational things to go out, so that at least you can get started in the process. You can let us know right away, hey, I'm not ready to schedule, but I'd like to study some of this stuff. Follow up with me at this point, right? So whatever stage you're at,
Mhm.
the research stage or the I'm ready to handle this stage, just let us know and we can definitely work with you.
Okay, yeah, that's awesome to hear. Yeah, and those are the questions that I had for you. Was there any last advice or anything you want to leave the patients with if they're struggling with, either ED or diabetes and just not sure what they should do?
Yeah. So I think like it's important to understand that ED is something that I mean, healthy sexual function and activity is an important part of healthy lifestyle.
Yeah.
And so we shouldn't neglect it. We shouldn't ignore it. We shouldn't pretend like it's not a problem, especially when you have a supportive partner who says they don't care, because there's nobody in this world that doesn't enjoy sex from the pure physical standpoint, right? Obviously, there could be other variables that make it enjoyable, of course, but we're talking about the pure act itself. I mean, the sexual act itself releases a lot of stress reducing hormones in the body. So
Mhm.
even from a purely physical standpoint, sex will make you healthier. And we all have enough stress in our lives right now with everything that's going on. So it's definitely something that I think needs to be incorporated. And in order to have a good, healthy sexual routine, you got to have a healthy performing penis.
Mhm.
And so I definitely think it's important to prioritize this,
Mhm.
especially now if this is the first time you're learning of these therapies, that there are options in front of you that can fix this problem that aren't going to be a detriment to your health. So definitely take advantage of this and start the researching process and move forward if you're ready now that you know there's options.
Yeah, definitely. That's really great advice. All right, awesome. Yeah, well, I love the work you guys are doing there, and I really appreciate you taking the time to talk with us today and share the education. So thank you.
Thank you for having me, Caleb. I appreciate it.
Yeah, of course. Thanks, Dr. Jones.